supine max hip flexion stretch. You're going to apply this stretch to the client for the purpose of increasing their maximum hip flexion. So the hip flexion that we're going to improve is the hip flexion with the knee fully extended. So this is the supine max hip flexion, the same way that you do the mobility test supine max hip flexion test. So what you want to do is make sure the client's knee stays fully extended. And make sure that they're near in range of motion for dorsiflexion. It's not going to be in range of motion, but at least you're having them at neutral or even slight dorsiflexion. You can, even for additional stimulus, intensity in the stretch, especially if they have deficiency in dorsiflexion, you can have them do an active contraction of the antagonist, the tibialis anterior, having them pull down into that dorsiflexion position. Just, again, depending on what is their mobility score on dorsiflexion. To apply the supine max hip flexion, knee extended, near end range of dorsiflexion, apply the stretch, and ask the client on a 1 to 10 scale, how intense is this stretch?
5.
5. So with the supine max hip flexion, not usually would you want to do this, but you could go all the way up to 7 if your client is very adapted to stretching and very used to that. Otherwise, horrible idea to push the client that far in stretching. Can create some other negative outcomes with pain and stuff afterwards. So it's better not to overstretch, better to go maybe to a 6 or so. So where are we at here? On a 6? Okay. So we're going to hold that stretch, and then of course in this position, we could apply methods like contract, relax, where the client's going to contract into you for 10 seconds and then take a deep breath and relax. Or we could apply contract, relax, antagonistic contraction, where they're using the hip flexors to pull this way. And then at the end, you would gently make sure that you continually hold that position and then let it apply a couple more degrees. Other things to do, of course, would be to do some soft tissue release by applying manual techniques and massage and kneading into the tissues, whether the lateral head of the biceps femoris there, or the lateral bicep, or the lateral hamstring, bicep femoris, or the medial head, semitendinosus, semimembranosus, working through those areas. You could also use something like a Theragun to work through those tissues while applying this technique.